In spas, salons, and holistic health centers around the world, people are discovering the incredible physical and spiritual healing potential of hot stone therapy. But the origins of hot stone therapy date back more than 5,000 years. Indians called it Ayurveda, or Ayurvedic medicine, and for them it incorporated herbs, flowers, and crystals, along with heated stones. Healers used the hot stones to relieve muscle pain and discomfort and allow the prana, or life force, to heal on a physical, emotional, and spiritual level. Native American cultures believed that the heat from certain stones was so powerful it could cleanse the body of illness and disease. Heated stones were placed directly on the body to ease pain as well as to heat sweat lodges during purification rituals. In the last 10 years, hot stone therapy has gained popularity as both a physical and spiritual healing treatment. Hot stone therapy combines massage with the application of hot or cold stones, which are either massaged over the body or placed upon specific areas. Basalt rocks are the stones most typically used by professionals in hot stone therapy. They are remarkable for their flawless smoothness and their natural ability to retain heat. All of the Earth's elements, the mountains, seas, rivers, and streams, participate in the continuous and miraculous formation of this type of stone. The various forces at work in their ageless creation also lend basalt stones an inherent magnetic field, which helps to rebalance the body's energy centers during a treatment. Hot stone therapy is a vibrant, exciting field, and once mastered, it can provide a lucrative and differentiating cornerstone to any massage practice. The benefits of hot and cold stone therapy. Hot stone therapy is a widely recognized holistic treatment with many therapeutic benefits. Hot stone therapy improves back, shoulder, and neck pain, improves lymphatic circulation, increases circulation, decreases menstrual pain, joint pain, tension headaches, and sciatic pain, promotes increased well-being and vitality, promotes grounding due to the high magnetic field inherent in the stones, and reduces overall stress. Cold stone therapy can be used on its own or in conjunction with hot stone therapy to help reduce local swelling, inflammation or redness, treat acute injuries, reduce tension headaches, reduce sinus congestion, and to tone and stimulate the body. Heating and caring for your basalt stones. Before getting started, make sure you have the following items on hand. Your Spa Pro Massage Stone Heater. Make sure your heater has been properly smoked out before the first use. A bowl of cold water to cool stones that become too hot or to add directly to the heater if necessary. A small table, trolley, or countertop large enough to hold the heater and bowl of water. An instant read thermometer to check the temperature of the water. A non-metal slotted spoon to easily remove the stones from the heater, a small net to hold all of the cozy toe stones and to prevent them from getting lost under larger stones, a protective liner to place in the bottom of the heating pan. The liner also helps to make the stones more visible. We also recommend that you have a small plastic bin set aside to hold the stones that are no longer needed during the treatment. This will free up space in the heater and simplify cleanup when you're done. Now you are ready to begin heating your basalt stones. Remove the inner water reservoir from the heater and fill to 1/3 capacity with hot water. Place the reservoir back in the heater and place the protective liner in the bottom of the pan. Now place the basalt stones in the heater on top of the liner. The white cold therapy stones are placed in a bowl of cool water. It is a good idea to organize the stones into groups according to size and intended use. Next, place the cozy toe stones in a small net to ensure they will not get lost under larger stones. set the temperature control dial to the preheat setting of 375 degrees. At this point, you may wish to add a few drops of essential oil directly to the water in the heating unit. As the water heats up, the oils will be released into the air, enhancing the ambiance during your hot stone therapy session. Finally, add the instant read thermometer. When the thermometer reaches the preheat temperature of 120 degrees, you can turn the temperature control to your desired setting. Selecting the right water temperature is very important when working with hot stone therapy. Although the overall operating temperature range of the Spa Pro heater is between 120 and 150 degrees, the ideal temperature range is between 120 and 130 degrees. If you are practicing the treatment with caution, the recommended temperature range becomes 100 to 115 degrees. Here are a few things to keep in mind when you are working with hot stone therapy. We recommend testing the temperature of the stones at the start of each treatment by holding a heated stone in your hand for a few seconds. If the stone is too hot for you, then it's too hot to use. Reduce the temperature setting of your heater and immerse the stones in cool water before use. Remember, it is always better to err on the side of caution than to risk burning your client with a stone that's too hot. Basalt stones naturally retain their heat much longer than other types of stone. However, smaller stones and stones used more than once during a treatment may need to be reheated. To reheat a stone, simply place it back into the heater off to the side of the other stones. It only takes a few minutes for a stone to reheat. Now that you have a thorough understanding of how to heat your basalt stones for use in hot stone therapy, let's look at how to properly clean and care for them. To thoroughly clean your stones, start by cleansing them with a scrub brush, an all-natural cleanser, and warm water. After cleansing, rinse the stones with water and lay them out on a large towel. Next, spray the stones evenly with an all-natural disinfectant. This will ensure that unwanted bacteria are removed from the stones. We highly recommend using an all-natural disinfectant. Chemical disinfectants may be absorbed by the stones and later released onto your client's skin, so it's best to avoid them altogether. In order for the disinfectant to work effectively, it must maintain surface contact with the stones for at least 10 minutes. We strongly recommend that you clean your stones after every use, but if you do not have time to disinfect the stones between each treatment, you may choose to disinfect only once at the end of the day. Basalt stones have an inherent magnetic field which has a strong gravitational pull. Cleansing and charging the stones after each use will ensure that any negative energy absorbed during treatment is not transferred from one client to the next. The following 3 methods are available for cleaning and charging your stones. 1. Fill a crystal bowl with pure distilled water and add 1/2 cup of sea salt. Stir the water until the salt is dissolved and then immerse the stones in the water for at least 30 minutes. 2. Leave the stones in the sunlight, either outside on a windowsill or place them outside under the moonlight, preferably under a full moon. The powerful rays of the sun or moonbeams will help to re-energize the stones. 3. A quick method to cleanse the stones and charge them is to give Reiki to the stones. While doing so, be aware of your conscious intent to use the stones for healing purposes. A small prayer or mantra to express such intent is also recommended. The following full-body treatment is presented in a condensed format. A typical full-body hot stone massage can be completed in about an hour. As you become more comfortable with the routine, you may wish to make modifications to tailor the routine to your needs as a therapist or to the individual needs of your clients. The following stones are required to prepare the client for treatment. 8 small bed heater stones. During the treatment, you may also choose to use the optional 7-chakra stone set, either basalt or gemstone, and the optional neck contour stone. Begin by removing the 8 bed heater stones from the heating unit. If you're using the net contour stone, remove it from the heater as well. Assist the client to a sitting position and ask her to securely hold on to the covers so they don't slip down. Carefully place 8 bed heater stones on the table so that when the client lies down, the stones will be situated in 2 rows of 4 on either side of the spine. Lay a thin towel on top of the stones and then assist the client in lying down upon them. If you are using the contour stone, place it under the client's neck. Therapists interested in energy work can integrate chakra theory and crystal healing into the session by laying the chakra stones or crystals upon the 7 chakra sites. The following stones are used to treat the front of the legs: 8 medium effleurage stones and 8 cozy toe stones. Remove 2 medium stones and 4 toe stones from the heater. Remove the blanket from the legs and leave the sheet in place to reduce the risk of burning the client with a hot stone. Place 1 medium stone under the right knee and 1 stone upon the upper right thigh. Remove the sheet from the right foot and wedge 4 cozy toe stones between the toes. If the stones are too hot to use immediately after removing from the heater, quickly immerse them in cool water. Cover the foot with a towel or sheet to help maintain the heat from the stones, and then drape the blanket back over the leg. Remove 2 medium stones from the heater. And remove the covers from the left leg. Apply oil to the leg with general effleurage technique, beginning at the foot and working toward the upper thigh area. Now, repeat general effleurage to the leg using 2 medium stones. Then perform more specific massage techniques to the upper thigh area, such as ringing, circular kneading, and reinforced circular kneading. At any point during the treatment, if you feel that the stones have cooled, return them to the heater to exchange for warmer stones. Be sure to include the knee area and continue down towards the foot. Holding both stones, use the spreading technique on the top of the foot. Then, using only 1 stone, perform deep kneading to the sole of the foot. This should be followed by a deep kneading to the sole of the foot using only your hands. Finish with more general effleurage and stroking to the entire leg. Return all cooled stones to the heater and remove 2 more medium stones and 4 cozy toe stones. Replace just the sheet over the left leg and place 1 new stone under the knee and 1 upon the left upper thigh. Then, wedge the 4 cozy toe stones between the left toes and cover the foot. Once the foot is covered, you can turn your attention to the right leg by removing the placement stones and repeating the massage on this side. When you have completed treatment to both legs, cover the legs and return all placement stones to the heater. The abdomen is a sensitive area, and you should always obtain consent from your client prior to working this area. If a client is experiencing discomfort associated to menstrual pain or digestive upset, gentle hot stone massage to the abdomen is highly recommended. The following stones are required to treat the abdomen: the stomach stone and 2 medium stones. Start by removing the chakra stones. Now, place a folded hand towel across the breast area and lower the covers to expose the abdomen while holding the towel securely in place. Gently apply oil to the abdominal area with effleurage technique. Remove the 2 medium stones from the heater and use them to perform gentle effleurage, sweeping the stones down behind the lower back to gently lift up. Following the direction of the large intestines, perform alternating stroking to the area. Always work in a clockwise direction on the abdomen to encourage digestion. Then, using only 1 stone, perform reinforced small circular kneading in the area of the small intestines. And finish with general effleurage to the abdomen using 2 stones. When you are done, bring the sheet up above the chest and carefully remove the hand towel from beneath. Place the stomach stone on the sheet over the navel and then cover again with the blanket. Remember to return all cooled stones to the heater. The following stones are required to treat the arms: 6 small effleurage stones, 2 medium palm rest stones, and 6 cozy finger stones. Apply oil while performing general effleurage to the right arm. Then repeat effleurage using 2 small stones. Continue with circular kneading to the upper arm using 1 or 2 stones. And follow with circular kneading to the forearm. Then perform the spreading technique to stretch open the top of the hand. And follow with stroking and muscle stripping to the forearm from the wrist to the elbow. With the hand facing up, repeat the spreading technique across the palm. Then use 1 stone to deeply knead the palm of the hand. Put the stone down and use your thumbs to knead deeper circles across the palm. Turn the hand over to stretch it and wring the fingers from the base to the tip. Finish with general effleurage and stroking. Return the cooled stones to the heater and remove 1 palm stone and 3 finger stones. Turn the hand over and place 1 palm rest stone beneath the hand and wedge 3 cozy stones between the fingers, excluding the space between the thumb and the index finger. Repeat the massage to the right arm. The following stones are required to treat the chest, neck, and shoulders: 4 medium effleurage stones and the optional deep tissue trigger point stones. Start by removing the contour stone from beneath the neck and returning it to the heating unit. Next, remove 2 medium stones and the optional deep tissue tool from the heater. From a seated position, apply oil across the top of the chest. Reverse effleurage out towards the arms and then up behind the shoulders to behind the neck. Then repeat effleurage to the chest, the shoulders, and neck using 2 stones. Gently roll the client's head towards one shoulder. Using 1 stone, perform circular kneading and stroking from the back of the neck down along the shoulders. Now gently turn the client's head to the other side and repeat. Then center the head and perform deep kneading at the back of the neck with the stones. Repeat deep kneading using only your hands. The optional deep tissue tool can be used to perform deeper work or for trigger point release. Finish with general effleurage and stroking. Return all cooled stones to the heater. Massaging the face should be offered as an option to each client. The skin on the face is sensitive and should not be exposed to extreme temperatures, so the stones should be warm, not hot in temperature. The following stones are required to perform treatment to the face: 6 small facial stones and the white cold therapy stones. Remove the finger stones, palm rest stones, and the stomach stone and set them aside. Assist your client to a sitting position and remove the 8 bed heater stones. Return all cooled stones to the heater and retrieve the facial stones. Using 2 stones, perform general effleurage beginning on both sides of the nose. Move up to the forehead and sweep out towards the temples. Then circle up and around the eyes. And from the center of the forehead, stroke out towards the temples. Repeat this process several times. Continue to effleurage along the jawline, always massaging upwards on the skin. Then repeat using small, circular kneading. Lay 1 stone in the middle of the forehead, and using 2 new facial stones, apply deeper pressure with a hold and release technique along the sinus cavities. Perform large, light, sweeping, overhanded stroking with the stones around the entire face, beginning under the jawline. Perform stroking up from the neck to the jawline. Use 2 white cold therapy stones and repeat the process. Return all stones to the heater or cold water bowl. The following stones are required to treat the back of the legs: 8 back layout stones, the sacral stone, 8 medium effleurage stones, 8 cozy toe stones, and 2 small effleurage stones for placement on the soles of the feet. You may also want to include the optional palm rest stones and the trigger point stones. Start by assisting your client in turning over onto the stomach. Fold over the blanket and leave the sheet covering the back. Remove the 8 back layout stones, sacral stone, and 2 optional palm rest stones from the heater. Above the sheet, arrange the 8 back layout stones into 2 rows of 4 on either side of the spine. Lay the sacral stone upon the sacrum and cover again with the blanket. With the sheet covering the leg, place 1 medium stone upon the upper thigh at the hamstrings and 1 medium stone upon the calf. Lay the small stone on the sole of the foot and wedge 4 cozy toe stones between the toes of the foot. Cover the foot with a sheet or a towel and drape the blanket back over the leg. Apply oil using general effleurage technique. Repeat general effleurage using 2 medium stones. Perform circular kneading. Using 1 stone only, perform reinforced circular kneading and ringing across the upper thigh. Place your hand beneath the foot and lift the lower leg to form a 90-degree angle. Using 1 stone, perform circular kneading on the calf, starting at the ankle and working towards the knee. Lower the leg and perform muscle stripping up the calf, starting at the ankle and working up to the back of the knee. Remember to perform muscle squeezing to the calf on the way down to the ankle. Continue with deep kneading to the sole of the foot. At this point, you may choose to use the optional deep tissue tools to work more deeply on the sole of the foot. Finish with general effleurage and stroking technique up the entire leg. Remove 2 medium stones, 1 small stone, and the 4 remaining cozy toe stones from the heater. Cover the leg with the sheet or a towel and place 1 medium stone upon the upper thigh and 1 medium stone on the calf. Lay the small stone upon the sole of the foot and wedge the 4 cozy stones between the toes. Once the foot is covered, you can now turn your attention to the other leg by removing the placement stones and repeating the massage on this side. When you have completed treatment to both legs, cover the legs and return all cooled stones to the heater. Now, remove the blanket from the back area and remove the 8 back layout stones, the sacral stone, and the optional palm stones and return them to the heater. Then, lower the sheet to expose the back and fold it over at the sacrum. The following stones are required to treat the back: 6 large effleurage stones and the optional deep tissue tools, which can be used anytime during the back treatment as determined by the therapist, especially useful during scapular work and for trigger point release. Stand at your client's side and apply massage oil to the entire back with general effleurage. Then remove 2 large effleurage stones from the heater and repeat the process. Continue with more specific techniques such as alternating stroking up the entire back and circular kneading to the upper back and shoulder blades. Then perform reinforced circular kneading using only 1 stone. Using 2 stones, perform rigging technique across the lower back. Followed by a deep circular kneading. Then, from the top of the table, above the client's head, perform reverse effleurage strokes down the back. Finish with gentle effleurage and stroking working up from the lower back to the shoulders. Then cover the back with the sheet and blanket and return all cooled stones to the heater. The closing. It is important to properly close or end your hot stone therapy session. A proper sense of closure is important for so many reasons. Not only does it let the client know that the treatment is finished, it also helps to ground out both the client as well as the therapist. Lay your hands gently on the client's back and give a silent word of thanks and bestow healing energy upon your client. Effleurage technique. Effleurage is a rhythmic gliding movement. Long strokes are combined with light to moderate pressure. Contact is retained on the return stroke, but no pressure is used. The rhythm used in effleurage can vary from slow to fast. Effleurage is used at the beginning of a hot stone treatment to spread the oil and is the first technique used when massaging with the stones. Petrissage technique. Petrissage is a broad term that includes techniques such as kneading, squeezing, wringing, muscle stripping. Pressure is applied toward the heart and released on the return stroke. Stroking technique. Stroking is one of the most superficial and lightest of techniques. Only the skin is stroked. The underlying tissue is not directly affected. Stroking is similar to effleurage, except that contact is not maintained on the return stroke. It can be used with a soothing and constant rhythm for a relaxing effect, or with a random rhythm for a more stimulating effect. Stroking is always used at the end of a treatment to return the blood flow to the heart. Contraindications and treatment modifications for hot stone therapy. When presented with an illness or medical condition, it is important for the therapist to know when hot stone therapy should be modified for safe use and when treatment is not at all advisable. General and local contraindications. General absolute contraindications make it unsafe to treat the client in any way, while local absolute contraindications make it inadvisable to treat a specific area of the body. Hot stone therapy is not at all safe or recommended for the following conditions: acute conditions requiring medical attention, such as appendicitis, diabetic coma, severe asthmatic attack, epileptic seizure, or heart attack; advanced kidney or liver failure; diabetes with complications such as gangrene, advanced heart or kidney disease, or unstable blood pressure; acute pneumonia, hemophilia, severe hypertension, high fever, or any contagious or infectious condition. The therapist can still provide treatment for a client with a local absolute contraindication, but must refrain from working on or near the affected area. Local absolute contraindications include any acute flare-up of inflammatory arthritis or inflammation to the nerves, surgery in which nerves have been cut or altered, resulting in a loss of sensation to the body, any skin condition aggravated by heat, any type of open lesion, recent burn or frostbite, and metal implants. Treatment modifications for hot stone therapy. When no absolute contraindications are present, the therapist can proceed with hot stone therapy as long as the treatment is modified appropriately and the therapist proceeds with extreme caution. Remember, if there is any uncertainty about treating a certain condition, ask the client to seek permission from a medical practitioner before beginning treatment. To modify or adjust a hot stone therapy treatment, the following measures should be taken. Reduce the water temperature to between 100 and 115 degrees. Always lay placement stones on top of a sheet instead of directly upon the skin. Check frequently with your client for feedback regarding the temperature of the stones and the effects of the massage. Modifications are required for the following conditions: cancer, hypertension, arthritis, multiple sclerosis, pregnancy, kidney disease, heart failure, diabetes, fibromyalgia, clients on medications such as anti-inflammatories, muscle relaxants, or analgesics, and for the elderly and young children.